and the examiner has given you command, examine the upper limb and do the relevant. So in upper limb examination, you found upper motor neuron type of weakness of the right upper limb. This is 2 by 5. Okay. So what you will do now? The relevant. Relevant علاقة مع هذا. ايش ابغى تشوف؟
weakness in the lower limb.
Yes, so face, first of all face. What you will see in the face?
Movement of the eye.
First of all is facial. Look at his facial asymmetry. If you have mild facial asymmetry, ask him to clench his teeth or smile. Then it will verify the deviation. And ask him to close the eyes. Yes. And if you go for visual field, you can go for visual field also. Alright, for the lower limbs,
Lower limb, I start with the inspection.
okay. So what you will check in inspection?
Muscle bulk, deformity.
Where up to where you should expose? Mid of the thigh.
Yes.
Up to mid. Okay. And second? No problem? You can give him some. Who is this one? Can I use that? Okay, so you have exposed up to mid thigh, right?
Okay.
Then what you are going to do?
The first inspection for scalp pigmentation, deformity, muscle bulk.
Quickly, yes, sir.
Okay, and the second is the tenderness.
No, before that.
Tenderness.
What was the more important thing?
Tone.
The position, right?
Position,
The
yes.
position, right?
Fit to drop.
So two positions are very important. Can you get aside, please? Please be with me. Excuse me. What positions are important in the lower limb?
Foot drop.
Foot positions.
Yes, in the lower limb. Why? You are not with us. You are making your own ideas. Can you tell me, please? Yes? Huh?
The position of the patient.
Yes.
Lying down.
Now, what position of the lower limb is important neurologically? Abnormal position in the lower limb is important neurologically.
Closing the legs off on
Flexion.
You want to learn? If you want to learn, please come forward. There you cannot. If you go without idea, come without idea and go without idea, then there is no use of the demonstration, right? You can come without idea, but you should not go without idea. Alright, so what is the important position? Two important things in the lower limb, right? One is with the stroke, that is proximal, right? External rotation, like this. So I told you try to correct, right? If I corrected and it got corrected, no problem. If corrected and then go back, then it is abnormal position, right? External rotation. Extension and external rotation of the lower limb is a clue towards stroke, right? This one was flexion and this is external rotation and extension. This is one. The other clue in position, you should always concentrate on these, right? These are very, very important clues. Foot drop. Normally we are keeping our legs in mid position. Dorsiflexion, plantarflexion, this is mid position, right? This is dorsiflexion. This is plantarflexion, right? This is midway between the two. So if it goes further down like this, right? Then it is a drop of the foot. Patient cannot maintain dorsiflexion. That's why it dropped down. This is a peripheral nerve problem. And the external rotation or extension of the limb is upper motor neuron type problem. It's a stroke, right? So these are very, very important clues. After this,
The tone.
before tone, what we did in upper limbs, which gives you the diagnosis, right? High yield point, concentrate on high yield point. You are in 4th year, your job is to tell us the abnormal things, right? So concentrate on these, and then you put them together and give a differential diagnosis. for a subject. 1, 2, 3, 4, 5. Bas khalas. In lower limbs, you will count up to 5. If this is not a conscious patient, he cannot obey commands. He is not conscious. What will you do?
Elevate the leg
Elevate, right?
with your
Elevate both lower limbs, right? Together. But I will not leave it. You will get hurt because you need a foam, a bed, right? Elevate it and leave them together. If this is weak, it will go first. And this will go second, right? If both are weak, then both will go suddenly down. You cannot maintain it. Similarly, in upper limbs, unconscious, uncooperative patient, you should raise, right? And then you will see which one is going down. Alright. So the drift is very important. Then after that,
one.
okay, then you have assessed. These are decorations, right? These are giving very less points, but these are decoration in your exam, checking the bulk, right? The fasciculations. This means sometimes you might get these if the patient is having hematrophic latent sclerosis, or there is a wasting. Patient is having a lower motor neuron type chronic demyelinating polyneuropathy, then you might get these wasting. But if you found the wasting only here, these are quadriceps, right? Then diabetic amyotrophy is very important. If you found the wasting only here, and here it is okay, so this is peripheral neuropathy, usually hereditary, Charcot Marie-Tooth. The calves are wasted and the thighs are normal. Or if the calf are hypertrophied and proximally they are atrophied or weak, this is Becker's muscular dystrophy, right? Muscular dystrophy, myopathy. Alright. Because of the compensated hypertrophy, their proximal groups are weak, so they take more support from their calf muscles. Alright. Now you go for tone.
Okay. Relax yourself.
We cannot go to the right side, so you can check from left side, no problem.
Yeah. Okay.
Look on the
Relax
side.
yourself.
You are checking tone at which joint?
The knee joint.
Why you selected knee? This is not up, not down. I told you neurology examination start from up.
Yep.
Yes,
From
up
here.
and you go down. Only sensory start from low. From the distal. Distal only in sensory, right? Proximal you should check first. Okay, how to check the tone at it?
Above and down.
Alright.
Okay. The head and the knee. Okay.
Foot, ankle. 3 joints. Which action you are doing?
The abduction and adduction.
There is no abduction.
Just
Dorsiflexion plantar.
inversion.
Alright, thank you very much. Somebody can improve this? Who can improve this?
How about the?
Okay, come
I'm not sure it's. I guess it's joint like this. Doing like this, like rotating the.
Alright, let us, can you please come down? Let us do it from the right side, then they can see it. Go down, please. I want to move the table. Let us move this table. So, right at the hip joint, the easiest way relax. La taharrik ana harrik. I told you in the upper limb, instruction very important. So first of all, you do instruction, right? This is passive movement. Anta la taharrik ana harrik as well. I will move your leg, you do not move. Right? So you hold like this and you see this fluctuation at the hip joint is conveyed in his all legs. You tense your leg?
Yes, because
You tense?
yes.
Make it tense. So when there is increased tone, it will move like cushion, a piece of wood. Right? There is no fluctuation. Decrease, raise. Decrease, it will be more wobbling, right? More fluctuation. Compared to the other side, this fluctuation, right? This is from the hip. If you increase that tone, then it is moving like one piece of wood. Right? No wobbling. Alright. At the knee joint, make sure that there is no osteoarthritis in the knee, no swelling of the knee, and ask the patient if he has any pain. You should ask the concern of the patient, right? If you have pain in the limbs, this should be first, it should be asked. Right, رجلك أنا حرك أنت لا ت- ما عندك ألم هنا؟ يلا. So quickly you pull it and you see normally what happens, there is little drag there and then it goes up. See, the heel will be dragged like this and then the foot will go up, the leg will go up.
What's the name?
Drag and then go up. If there is increased tone and I do like right, it will go suddenly.
No drag.
Yes. Right. If this is reduced tone, hypotonia, so it will be dragged like this, not going up. Drag and then shear going up, right? Then at the ankle, you check dorsal right. Dorsal, bring it in this position. 35, 45 degrees. Flex the knee, and then you do like this, right? Okay. Dorsiflexion, plantarflexion, if you feel there is increased tone, shut it, then you feel the increased tone, then you do this. Khalas. Quick thrust like this, and keep it. If there is increased tone, you will have like this tone. Clones. Similarly, compare on the other side. Right? No need to waste your time on checking on the toes, right? Do not waste time on checking tone here. This is of no use. Three major joints: hip, knee, ankle. Clear?
Yes.
After this, okay, please. One more candidate, please come here.
Yeah, the last one.
Okay, please. The last one. Okay, last one, please. He is demanding for the last one.
Yeah.
Okay, please come here. Good. Okay, please come on the right side.
Check the bar.
See, just remove your scarf, please, and relax yourself. You know, first thing I told you, what is the first thing? Instruction, right? Instruct the
He
patient.
instructed.
What instruction? Please say loudly.
Resist me.
Now,
Ask him to elevate him.
exactly. Right? So first of all, you will
Elevate
tell the
us.
patient that you are going to move.
Oh.
Antaharrik. Right? And I will stop you. You do not let me stop you.
The patient.
خليه
Yes.
يرفع ايه هو.
And tone, you will ask the patient, you do not move, I will move for you. Now you are going to explain to him, أنا أبغى أفحص كم قوة عندك. Right? I will check your power, your strength. You will move the limb and do not stop me. Do not let me stop your limb, right? Okay. Instruct him.
Now I will check your power. You move your limb and I will try to resist. Okay.
Okay, I told you act for the patient, right? Give him a target, right? لمس هذا برجلك. You are submit. Count. 1, 2, 3, 4, 5, right? He was not drifting, we checked. Alas, cover, subject. Now this is action. What is this action?
Flexion.
Flexion at the head. Now I will come. Kawam, ثبتني, لا تخلي. ممتاز. You encourage the patient, right? And apply your full force. I cannot overcome it, right? Similarly, now that's it. No, this side, from this side. Give him a target, yes.
And try to.
Okay, tell him submit, Kawam. Full power. Full power. Okay. Alright. Even with full, I should not overcome, right? Because young men, I should not overcome. Legs are stronger than arms, right? I should not overcome him. Alright. Then?
The other side.
Extension.
Yes, you. Alright.
Raise your
Action and then counter the action. That is why you ask him flexion, not ask him the flexion, right? Give him a target. What will be your target now? You put your hand under his thigh and ask him to press my hand, please. Press my hand. Press tahat. Press this one, yes. Nazal tahat. Press it, yes, very good. And I will try to overcome. Kawam. Mumtaz, right? First action and then you counter. Ideally, it should be like this, right? You should do extension like this, right? And then you press. But the patient is lying down, so we ask them to press the hand. Now the other side. Yeah.
like this.
Yes. Yes. Okay, now you raise it. You cannot raise it. Yes. Okay. This is
Extension.
extension of that. This one's flexion, this is extension. What else? In the
The head action.
okay. Adduction. Now you are doing adduction. Okay. Ask,
the side
okay.
same
Ask him to close the legs and you
Close your
open.
leg and
Oh, now you open.
Abduction.
You cannot open, right? Okay. Now abduction. So this is 4 by 5, right? Or 5 by 5. 5.
6.
Alright, now the knees.
Mm.
You know the crucial is hip and ankle, right? If a patient has stroke, all will be weak, right? Or if it only cortical stroke, maybe this is weak, or maybe this is weak. Only very rarely, if you have radiculopathy, right, then you might have knee weakness. But these are very crucial, these two. Alright, go ahead. The knees, yes.
Not try to.
Ask him to flex, itan reject and you overcome. Itne hai, itne
Like
hai?
this.
Ah, yes. Okay. That's the other side. Itne hai. First of all, check flexion, then extension. Itne hai. Okay. Madhya.
The correct side.
Madhya. One with one.
One hand.
Yes. Let this. Madhya. Yes, Madhya. Let this. You cannot overcome. Madhya. هذا خلي. Madhya. Right? You can overcome. Full power. Yes, full power. Alright, خلاص. Now the
Flexion. Flexion.
This you are checking which power now?
Those.
Plantar flexion.
He is applying pressure from here, power from here. Right?
So,
So how to you have to counter this first.
like this.
Added and flex.
MSIC here.
Oh.
To counter, he should not apply this power. Okay. Alright, then ask him to do dorsiflexion. Wait. Act out for the patient. سوي كده مشط القدم فوق كده. أيوة قاومني ثبت. ممتاز. قاومني ممتاز. كده دوس بنزين
This
دوس
clutch.
أيوة clutch. Okay, this and then eversion and inversion. Okay, this is inversion. Sector رجلك.
ما بغينا سكر رجلك ها.
Okay, you cannot open them. This is adduction. Adduction. Counter.
How
right?
should I
Do the eversion like this. right here. أيوة ثبت كده ثبت and now you press from here. So I cannot. ثبت كده أيوة. And do like this. This is eversion. سكر. طيب سكر. Cannot open. سكر. Cannot open. All right.
Thank you.
All right. Thank you for you. Now, one more from where I should go. Right or يمين ولا يسار؟
فيصل
In front of them جلد. After this, what do you do? Hurry up, no? Because we have half an hour. Okay. After this, lower again. We have checked power. Now what will you check? Okay, let me give you a clue. If you are not sure of the power, right? Listen please.
Yes.
Very important. If you are not sure of the power, 4, 5, or 5, you are not
Patient's
sure, right? So you keep in your mind that this is not conclusive for you. During checking the gate, you will ask the patient to sit down and stand. This is for proximity. If he has weakness, he cannot stand from there. And ask the patient to walk on the heel. Right?
Coordination.
This is for
This the muscle.
this for
Dorsiflexion. This the muscle.
Cuff.
peroneal, dorsiflexion,
Yeah.
peroneal. And it walks on the toes. This for
Posterior.
gastrocnemius.
Yes.
So distal weakness. Distal weakness, if somebody has weakness, cannot walk on the toe, cannot walk on the heels. If you are not sure of the strength, you can counter check by this simple test. The proximal one, from sitting, he should stand up. If he has any weakness, he cannot do without taking support from the hands. Or if he has any weakness, he cannot do heel or toe walk. That is for distal
You
weakness.
can do it, it's fine.
Yeah, it is fine. If you are not sure, don't utter. Counter check by these tests, right?
You can't walk on this.
Yeah, if he cannot walk on the toes, he is having weakness distally. If he cannot walk on the heels, he has weakness distally. If he can, then there is no weakness. This is between 4 and 5. If you are doubtful, you can counter check. After power?
Reflection
I don't
Coordination.
know. Coordination, because once you start tools, you forget, right? So do it, coordination. Do it. It's okay. Both are okay. It is up to you, but my advice is to do coordination and then go for the tools.
without tools, it's not.
Yeah, coordination. Coordination is needing your hands only. Cerebellum coordination. Coordination. Heel shin.
لو يمشي رجله على
Heel shin.
يمشي كعبه على الشن هنا واحدة
خلي مسكتها. شوف هذا أنا أقول واحد ارفع رجلك فوق. When I say 1, raise your leg. When I say 2, put it here. When I say 3, do it like this, right? 1, 2, 3. Again, 1, 2. We cannot do, right? So this is coordination for the other side. 1, 2, 3. So you will see he can
On both sides.
Drag this like this on both sides. Heel shin test, right? For coordination. Okay, thank you very much.
Yeah, right.
Okay, can you please come? Now after coordination. Now after coordination. Reflexes. We have it and the first tool is this. Alright, first position and then you take keep it here and position
هذا الشاحن
No, while it's
بقى 17 يا فدي
of course, you should instruct the patient.
No,
without.
just tell him أنا يبغى يضرب هذا يضربه باللطف ما يضرب.
ترى من يوم شوية ركز عندك. ها؟ السنة الماضية كان أبغى
Hold,
Patellar
relax,
tendon.
right? Check this is relaxed, right? Very نفسك ها لا تشر and check the tendon. This is the tuberosity of the tibial bone and this is patella. This is tendon. Palpate the tendon first and you should look at there and this should be a free fall. Right? A free fall. So you look at that there. If he is tensing you will not get it right way.
نيجاتيف
It's a free fall, then observe the jerk there. Right?
Oh,
نعم
Right? So you reposition and right? So
how about
then
lifting it? Doctor?
if you do not reposition and you not palpate the exact and you don't know this how to hit, then you will not get it. So this is the practice.
So why?
Which you should have done from third year till now. You should be smart in doing this. This was the job of third year. Please have this. Check again.
Doctor, shouldn't you let the leg?
So we got it. Alas, we got it. Alright, now the ankle. Okay, let us give a chance to your other colleague. ما يحتاج.
Another time.
يا شيخ شرف. So first of all, new position, right? This is the position, right? Hold by your hand. هذا right?
يس
أنت يمنع يمسك
تولى من هذه
Then if it is not a reposition, right? Maybe extensive, right? Reposition, middle and dorsiflexion, very good. Okay. Yes. On this side. This part here. Mid position, امسك كذا كذا يعني كذا شوي كذا. Yes. Nice. So only right? Do not lock yourself. Many people do like this, right? So you should not lock yourself. Bring it here, 45 degrees, and dorsiflex. It is right. Dorsiflexion and check. This is supple, right? Is not tensing. Dorsiflexion and free fall. Right? A free fall of the hammer from the top. Okay. Thank you. Okay. After this,
Fine.
what else? منها حبيبي اللي ورا حبيبي مش بقى حلو. After the ankle reflex, what should we do?
Science.
Not the ankle. Plantar is not Zelensky, plantar. So,
Should I do the plant?
yes, plantar. Okay.
Should I explain it to the patient?
First of all, explanation. Instruct, right? If you do this, please, in Western countries, right? In Western countries, if you do this test without explanation, then you should be ready for next exam. You must warn the patient, right? In Western countries, they never allow you to do whatever you want on the patient. You must instruct, right? For this reflexes, you tell them. For this also, you tell them. Because some patients are so sensitive, when you touch, they will fell down from the bed. Okay.
اوكي بلمس رجلي زين بس بشوف
ما عندك دغدغة، أنا أتأكد ما عندك دغدغة. ما في دغدغة.
اوكي ريح رجلي
امسك من هنا، من هنا. أيوه.
اوكي
More left. No, بالعكس.
أول أنت سيب.
طيب
بس شوي أقوى شوي. أيوه أقوى شوي. شوي أقوى. طيب. Right. So if he's ticklish, right? If he tells you I'm sensitive, you put this here and press it, right? For a while, it will remove his ticklishness. So you press it and then you scrape it, right? Then you will see the response, right?
Dead.
No. If it goes like this, or if this faints, Babinski sign, fainting. Right? Two things are there. One is this, right? This is also Babinski sign. Fainting also Babinski sign. And both together, right? So three possibilities. Only fainting, or only upgoing, or both, right? China faint. هذا faint, right? هذا يمسك حريم الصينية يسوي كذا هذا faint. كذا. They close it and they open it. They do like this. This is faint. Okay.
Other signs out of before.
All right. Huh?
There's other signs but I'm not sharing
These were in third year. How to elicit if the patient has problem there, what is Broughton, what is open hem, what is Shed, what is reverse Shed, touch. In fourth year, what is the abnormality? And where you localize it? And what are the differentials, what investigation? And how you will manage? You should not spend time on these minor things, nobody will ask you, right? This is not the examination of the technique only. That was in third year. We were examining only technique. If your technique is okay, you can pick some big your normal finding. Here in fourth year, we look on your technique also. But the more emphasis is on picking the findings and correlating them, right? Alright. So after this, the sensory, right?
Yes.
The sensory is I told you, right? But the more important one is the sensory level in the lower limb, right? If he has both lower limbs weakness, he has weakness of both lower limbs. That is called
Paraparesis.
paraplegia or paraplegia, right? So paraplegia, you have to check the sensory. That is very important. Crucial, right? Because initially I told you patient may be in spinal shock and this will all look like lower motor.
Yes.
But it will not be actually. So we will check, prick him, check the visualization. This is a reference, right? And you start from here. So your first question will be Thais. The second question?
Is it the same as
Say fog, right? Like up, same like up. If he tells you no, I don't feel it, or it's not same like up, then you start and tell him